If you're a dentist, a dental hygienist, a dental assistant, or even a plumber or a waiter, my question is, do you consider yourself a professional athlete? Because we are. We're professionals. We get paid for doing something, and that's what a professional is. We get paid for giving a service. And as dentists and people who work in healthcare, we're particularly prone to back pain, to neck pain, to all sorts of physical ailments. That's part of the reason why we have disability insurance. Did you know that close to 80% of all dentists suffer from chronic back and neck pain? I'm one of those dentists. I hurt my back when I was in my 20s, and I've had back pain from the age of 20 up until about 8 or 9 years ago. It finally ended, thank God, and I found out what I needed to do to take better care of myself. I tried to take good care of myself, but it wasn't working. Why do I make such a big deal about this? Because a lot of dentists don't realize the importance of taking great care of their body. If you see people that do a lot of dentistry, most of them are in pretty good shape. Most dentists do suffer. They say dentists are always on a golf course. I don't understand why they say that, because most dentists have bad backs, and it's hard to swing a golf club when your back's not very good. But I'm a strong believer in taking great care of the body. Luckily for me, I enjoy doing it. I enjoy working out and going to the gym and doing all those things. It's sort of a passion of mine. But for many people, it's not. We are in the healthcare profession. We take care of others. We are caregivers. And it's hard work. We're leaning over people. We have instruments in our hands. We're turning like this. We're bending over. It's hard to get into this little dark space. And plus, we have the stress of being close to another human being who's in pain. And we have to produce, and we're going from room to room to room. So dentistry is a very difficult job. It's physically very demanding. If I knew it was going to be this demanding, would I still become a dentist? Yeah, probably yes. But I would have probably taken a little bit better care of myself early in my career. So, what do I think you need to do? Well, certainly the simple ones. You need to eat right. And I'm not going to go over what that means because I'm not a dietitian. But you need to take good care of yourself and try to keep your weight at a reasonable level. Because the more weight you put on, the more stress you're going to have on your back and your neck when you're leaning over. You should exercise. And that requires both, lifting weights, because we start to lose muscle mass, as soon as we exit our 20s, if not before that, our muscle mass starts to decrease. And I always say you want to exit your 40s looking as good as you did when you entered, your 40s. Or basically, when you're 30 years old, that's when things start to break down. So when you're 39, you want to look almost as good as you did when you're 30, if that's possible. Because that's when the metabolism starts to slow, we get very busy, we start to have families, we start to have the stress of running a business. So in our 30s, a lot of us start to break down. So you start to have to run, bike, swim, whatever it is. So weightlifting is important to maintain your strength. And we have to use our muscles, and our muscles are not going to give back to us unless we work them. And it does require some discipline. How much you should lift? Well, that's going to be varied, but you should be doing some intense workouts, perhaps with a trainer, perhaps at a gym, whatever you want to do. But on a daily basis, something should be done. I recommend at least 2 weight training workouts a week. Aerobics should also be done. I was a long-distance runner for many years, which was probably not the best thing for my back. I used to do triathlons, and I had to stop running when I was 56, about 15 years ago. And I can't run much anymore because my lower back gets sore. So I overpounded it. So long-distance running, unless you have a body that's really meant, to be able to do that, some people can do it. Probably not the best thing to do for a long period of time. Although from a personal perspective, it was a lot of fun. Just like my friends that were ex-football players that played at a high level, they said, I love playing it, but my body's paying the price now. And the question I always ask them, I go, would you play again? They go, definitely. But as a dentist, I need to take care of my body. Luckily, I wasn't a football player, so I haven't had any joint replacements. But I was a long-distance athlete. I leaned over patients for the last 40-plus years. I ride a bike leaning over, and that puts a lot of wear and tear on the body. So I still do aerobics, but not as much pounding as I used to. I'm still on a bike. I do a lot inside on a Peloton, and I'll use an exercise trainer that's sort of not too traumatic on my body. And also I get into the swimming pool. So aerobics is important because you got to maintain some aerobic ability and also keeps your muscles going. But what I've done more recently is a lot more stretching. I've always been someone who did martial arts or yoga, but recently I've had to up the amount of stretching that I do. And so I continue to stretch on a daily basis. And in the office, I even have some yoga blocks. I have a roller, I have balls, I have all those type of things that I can stretch. And probably once every hour or two, I try to do something like this or something like this and move around because it's very easy to get locked into doing these long procedures. So stretching is important. Meditation, of course, is important to decrease some of the stress. We are in a very high stress business. If you don't like to meditate, you can pray. If you don't like to pray, you can just walk in the woods by yourself, do something outside in nature. You can do yoga. There are many different ways you can find that. If you don't want to do it by yourself, you can find, maybe your significant other will go with you, or you can get a group of friends to go, or you can join a gym to go. I actually just took up Taekwondo again. I haven't done martial arts in 19 years, but I started to see what these little kids are doing in a gym. I'm thinking I'm never going to get up and be able to be that acrobatic, but it's very challenging. And one of the things that I've noticed as I've gotten older is maybe my memory doesn't work as well. And so with Taekwondo, you have to remember things, and so it's been helpful. I think my memory is coming back, short term, not long term's working, but short term I think has been helping a little bit, and certainly helps with balance. One of the things that takes out most people when they get older, besides heart disease and cancer, is falls. And as we get older, you get to go to the bathroom in the middle of the night, you're very healthy, then that one fall. The bathroom is one of the most dangerous places for someone as we start to age. So balance, I think, is very, very important. It's also important because we get so tight from doing the dentistry that we need to work those muscles. And we need to be able to develop those proprioception that sometimes tends to wane a little bit as we get older. So diet, of course, don't be overweight. Do some weight training on a daily basis, or basically not a daily basis necessarily, but certainly movement 2 or 3 times a week. Push it, and some aerobics, and then the mindfulness training is important, and then sleep. I wear an Oura ring, so I track my sleep. I've been doing that for 6 years. And I get sort of competitive with myself. If I don't get over a 90, I'm thinking I didn't get a good night's sleep. And one of the things I noticed that when I was younger, I used to brag, I don't need much sleep. I can go on 4 hours. Well, that's not a good thing to do. Nobody can go on little sleep. Some people say they can, but the reality is that we do need sleep. Our body has to repair, both physically and psychologically, and of course spiritually. And so I try to get a good night's sleep every night. So if you're not taking great care of yourself, start. And I've talked to a lot of people, especially young people, people in their 30s. They go, I don't have time, I'm too busy. Well, if you don't make time for yourself, no one else is going to give you that gift. So what do I recommend if you don't find any time? Well, at 5:30 in the morning, not a lot's happening. And people, well, it means I got to get up early. Yeah, it does. It means that you got to go to bed early. So my suggestion always is at 5:30, the phone's not going to be ringing. You can get a lot done. As a matter of fact, I have one employee, Karen, that comes in the office around 6 o'clock in the morning. She lives like an hour away. And I get in there, no matter what time I get in there, she's working on a computer. I go, what are you doing? She goes, it's the only time I can get something done. Matter of fact, I said it to my son, who's recently had a baby, and he's been real busy, and he's busy at work. And I know what it's like to be in your 30s and be busy at work with a young family. Those are your busiest times, but that's the time when you gotta, basically, when a plane's going down, grab the mask, and what do they say? Put it on yourself first, then put it on somebody else that you're gonna help. So we are in a service business, but here's my strong, strong suggestion to all of you. Be kind to yourself. Serve yourself first. It may seem like it's selfish, and maybe it is. You're taking care of yourself first. But if you're not selfish, if you don't take care of your body, your mind, your own physical, spiritual, and mental health, nobody else will, and you won't be able to be the gift to others. So that's my message today. Maybe it's a little preachy, but I certainly believe this, and I'm very passionate about it, and it's something I think is real important. Oh, by the way, one more thing. Why don't I have any pain today? Well, I went back to yoga on a really big manner about 8 years ago, and I found a healer. I found her name is Dr. Chia Wu. She's a chiropractor. She doesn't do any chiropractic manipulations. We do acupuncture, we do deep cupping, we do muscle stim, and I saw her probably once a week for about a year, and now I see her maybe twice a month. And literally, at 71 years old, I could say I'm pretty much pain-free on a daily basis, which is amazing because I've been in pain for about 40 years before that. So I was the gift to myself, and I want you to be the gift to yourself so you can be the gift to others. Have a great day, everybody.